received 100 feet.
Okay, no problem.
Level.
Sir, recording started. You can welcome and take the class.
Okay. Okay. Thank you. Good evening, friends. Elect members. Welcoming you back for another session. We started at 4 o'clock. When Appakutti was there, he will be there before 4 and start.
Strict punctuality.
Today,
Strict punctuality.
Today we are starting at 4:10 and still people are not joining totally. Not yet. Of course, whoever comes and hears, it's only informative, a good thing for them to treat their family members, relatives, etc. Yes, George has received a recording from old man. So, a little contribution by elect members of the homeopathic group will give people a belief for women. Belief for women. Many still who are ardent allopathic mongers. They don't listen to anybody. They will only go to their family doctors. Of course, most of the family doctors, they are treated properly. But the problem is the medicine. The medicine combination that is not going to give the desired effect. So, do you want to say homeopathy? You have every equal effective treatment when you choose medicine. Homeopathy is equally complicated, but it is not in the hands of the drug manufacturer. It is in the hands of the homeopathic physician. It is not with the drug manufacturers. The doctors depend upon drug manufacturers. There are new inventions. Whereas homeopathy depends upon the physician, because every medicine is in the chest. Every medicine is in the chest. It is arming every homeopath. How the bullet or arrow is to be chosen and administered is the efficacy of the homeopathic physician. Okay. Today I want to share one information. A well-settled Indian physician in New York, America, has been repeatedly telling there's nothing to worry about cancer, provided you follow certain 3 principles. What is it? Since 3 principles. One is take your sugar out of your table. That is, don't take sugar at all.
Correct.
The aged or younger or educated. Sugar also should be totally avoided. Second thing is, take 3 tablespoons of wine, mix it with warm water, take it daily in the morning, half a glass. He says that cancer germs will never touch those parts that are imbued with lime particles. He also says when sugar is avoided, cancer germs are becoming helpless because they get motivation because of the sugar particles in the water. The third aspect is, he said, take 3 teaspoons of coconut oil in the morning and in the night. Simple things. It's available in the whole of India. One you can avoid taking this crystal sugar. You can have the jaggery powder. Second is, you take lime juice, 3 teaspoons of lime with lukewarm water. The third is, take 3 teaspoons of pure coconut oil, that is, free from all chemicals, free from all chemicals. Even in the preparation of the coconut oil, sometimes they put jaggery or something like that. That is permissible, but they should not put any chemicals. It should be pure coconut oil. It will be available in the original caches. So how simple it is. He is telling us from America. He is alive still. Instead of that, he said that if you take rainwater, that is 1,000 times stronger than chemotherapy. See how research they have done. So the survival they came. The elite group meet for exchanging good information, not only mere homeopathy, but also about good and bad, likes and dislikes, do's and don'ts, etc. All these things are being so that the object of keeping oneself healthy all the time, even at the age, without depending upon it, family members or your daily routine work is a boon to the elite members. Thank you. Yes. Sir, there are many versions about the aspect of homeopathic drink. That is, a poet describes a flower in a very many different languages or in many different ways. Similarly, all our mythology, the rishis, munis and saints have described the God in a different combination. Why? To have a very clear picture about the goddess, God, their powers, their healing powers, their protection to the humankind, etc. Homeopathy is also one such thing. It is analyzed in a different angles. Today I am going to give you a different angle of analysis. We can take it as a hint. What is medicinal aggravation? Medicinal aggravation or inestimable value of management of disease. We give medicine, aggravation takes place, estimable value of management of disease. The disease is managed by the medicine, but it shows its different colors and actions. They indicate as the expounder of homeopathic philosophy. This is the coin given by Dr. D.J. Kent. He says that the expounder of homeopathic philosophy is there, disease is with us, physician gives the medicine, aggravation takes place. So, homeopathic medicine shows and totalizes symptoms of past history, like and dislikes, mind symptoms, etc. Able to expound the homeopathic philosophy. What is homeopathic philosophy? What are all suppressed by chemicals, medicines composed of chemicals. When homeopathic medicine is rightly chosen, definitely it will try to bring it back. It's a fact. Even if it is possible, no doubt. For homeopathic there is no doubt. I think elect members also have no doubt. It is possible because a right chosen remedy not only cures your present symptoms, but also gives you a disturbance in the body. Those disturbances are called, all the suppressed diseases are coming out. See, go back to Dr. Gupta's statement. Just now he said, when you don't take sugar, carcinogenic germs, cells, the virus, and will lose their strength. So it cannot survive them. If you take lime water, in lukewarm water, it strengthens your tissues, thereby it acts more than a chemotherapy in the body. Same way, homeopathy also goes and disturbs, it gives you relief to the present problem, but it brings out your suppressed diseases. Yes, see, 2 to 3 statements. When you read it, it's facing. You don't know, you don't understand. When I deeply explain that, you will be able to understand how efficacy is the homeopathy, how deeply acting, penetrative acting is the homeopathy, because it is a similar current. It expels the morbidity from the body. By its action, the vital force gets rejuvenated, it becomes stronger, and it fights disease. So many things are embedded. Yes. I said aggravation. Now I go deep into that. If the aggravation is wrong, with the decline of the patient's strength, the case is incurable and only palliative drugs should be given. See, it's an indication to be homeopath. We are given a drug based on the symptomatology, based his past history, where his legs and his legs. His mind symptoms or etiquette may be, he has chosen the correct remedy. If the aggravation is long, it gives us the decline of the patient's strength. That is, not only that aggravation and bringing about the other symptoms or other suppressed diseases, the vital force is not rejuvenated. Patient says, sir, I am happy with your dose. No problem. I feel better. But I got other symptoms. This has been long back suppressed. You will not say suppressed. Cured by this doctor, that doctor, like that. Now here, if the aggravation is long, that means the patient's strength is very weak and his strength is declined and it is most incurable. Most incurable. So, can a homeopathic physician say like this? Incurable? Yes. Something is beyond our reach. It's only God who cures. We give, we treat, He cures. He cures. These are one of rare cases, not all cases. What we will do then, we will give palliative medicine. The more and more palliative medicines are, there will be a break. Sometimes the patient needs up. So you said, carbohydrate is a carbohydrate. When you give the carbohydrate, the patient will come back to conscious, is away from the deathbed, etc., etc. Now you say it is incurable. It is an indication only to the patient, physician, not to the patient. We know his terrain, what is his base. No, he has come to that stage. Let us give him palliative drugs. Keep him long. Keep him long. Keep him alive long. First when chemotherapy and immunotherapy is introduced, they said that we all need this because the patient will have strength to fight the cancer germs. We make him long. Yes, we make him long. At what cost? 30 lakhs, 50 lakhs, 60 lakhs, 1 crore? Can everybody afford to? Yeah. With the aggravation is gone, with the slow improvement, this is a better statement than earlier statement. Aggravation is long, declining patient health, it is incurable. Aggravation is long, with slow improvement. You give palliative medicines continuously, there will be a slow improvement. All will be well if the remedy is not too soon repeated. You should not repeat the medicine too soon. We give some periodical time, of course with adequate potential. This is why the eminent homeopath should use his brain, use his capacity. Then he must give medicine either 200 potency, 1000 potency, as the case may be. In that case, it should not be repeated soon. You must give time for the medicine to act. so that the patient revives from his problem. Because you are giving sufficient potency and adequate time, the longevity that you are given help the vital force to become stronger. See, intricated, wherever you go, whatever you do, with the confidence, you give the prescription medicine. The vital force should be strengthened by your medicinal action. Not that you are giving directly medicine to the vital force. You give medicine based on the symptoms. When the symptoms are ameliorated, when the symptoms are cured, it is an indication that medicine acted well in the body, rejuvenated the vital force. You go back to Hannibal's theory, first class, what you have understood. We treat so that the vital force is rejuvenated. The pendulum diagram has been shown. When opacity was there, it was shown in the equal pendulum like. When vital force gets normal, it will say to the body, oh look here, don't worry, I'll take care of it. I'll take care of the disease. Slowly he expands. Slowly the morbidity comes out. Either it is from the lungs, either it is from the kidney, either it is by your sweat, either through motion. Everything is clear. Everything is clear. If the aggravation is sharp and violent, the best result will fall. Here, a statement that homeopathy should not forget. If the aggravation is short and violent, the best result will come. It is in the case of acute diseases. It is in the case of acute diseases. If the quality and quantity of the remedy administered are in exact proportion, so you need to say, I have to take this cross and see that disease force and medicinal force, medicine, and weigh that. Yes, that must be weighed in your brain, physician's brain. He must weigh it in his brain. In one pendulum, he put all the complaints of the patient. In one pendulum, he decides what is the best medicine at the present circumstance. Should I give palliative? Should I give a very, very effective drug? As the case. So this parameters always should run when you treat the patient. If the quality and quantity of the remedy administered are in exact proportion to the quantity and the quality of the sick-making force, not sick person, sick-making force, that is disease force. I repeat, very beautiful saying. The quality and quantity of the remedy administered are in exact proportion to the quality and quantity of the sick-making force, then do we have a cure without aggravation? Definitely there will be aggravation. Every medicine aggravates, no doubt. Some are felt by the patient, some are ignored by the patient. Because he is already covered many of nature. He finds this comfortable. I told you, when medicine is given to children during fever, unlike allopathic system, the children go and play, mother gets worried. Temperature is 1 or 2, the child is after taking homeopathic medicine is playing. Aggravation is there, but they feel comfortable. What a beautiful state. I will repeat you again for this. You should never forget. The quality and quantity of the remedy administered, that is homeopathic medicine, chosen and given, are in exact proportion of the quality and quantity of the sick-making force, that is disease. Then we have cure, very, very authentic, confident. We have cure without aggravation. Can cure without aggravation is asking us. Yes, there will be aggravation, but there will be cure. Patient will come and say, sir, I had some difficulty for a day. Afterwards, after 3 to 4 days, after continuation of medicine, every day 1 dose, I feel comfortable today. I now feel agile, very free. Alright. If we have an immediate annihilation followed soon by an aggravation, it is a failure. The case is incurable. It takes to the second statement I have given. If the aggravation is long, with the declining patient strength, it is incurable. But homeopathic physician never rule out it is incurable. It is only indication for the physician by his observation that the chosen medicine has disturbed him, given him a lot of disturbances, but I find because of his complications, he is in an incurable position. But still, as a physician, I do not lose hope. I will give medicine, palliative medicine. Slowly, incurable condition turns to light curable strength condition. Patient will come back saying, though I was telling you all these problems are not for the last 6 months or 1 year. Now I feel better. Some problems have been overcome by the present medicine. Because we have been completely giving palliative medicine to strengthen the vital force, not to disturb the disease, strengthen the vital. Here, if the full amelioration of symptoms occurs without increasing the patient's strength, he will prove too weak for restoration to health. Again repeat, if a full time amelioration of symptoms occurs without any increase in the patient's strength, amelioration there, he feels better, but his strength has not been increased. Sir, this problem is not there, that problem is not there with your medicine, but I don't feel strength. still I feel always bedridden. I am not able to get up. Without any increase in the patient's strength, he improved 2 weeks for restoration to him. That is, he is very, very weak to come to the normalcy and health restoration to him. It is only a statement given to the homeopathic physician. When you begin to treat patients, when you come across all these problems, you should not be judging them, aggravated. You also should not be confused. You should never be confused. You must take things with confidence. Yes, 1 or 2 medicines that you have given have not have acted at all. You should not think, I have taken so much of care, I have studied this book, that book, according to the patient, I have just gone to the computers, take them everything there, this is the result, this must be the medicine, that's what I chosen, I go to the patient, but he is repeating like this. More than the patient, you are getting disappointed and weakened. That should not be done. You must take everything with a smile. Everything is all the time. Don't worry, you will become normal soon. See, how much time they take to cure a cancer patient when cancer cells are confirmed in the body. They will say the bits about the patient. Why? They give all medicines. The patient will act. The patient will not act. It's not telling the patient. Chosen is correct. Medicine given is correct. So, a physician should not lose hope. What I am trying to say, a physician should not lose hope when some of those reports stated by the patient in the next sitting or second sitting or third sitting or because you have studied the patient well in the first sitting itself. Second sitting, you have followed all the present complaints gone, some other complaint, new complaints have come, you know his history, his background, he has been suffered by all diseases. Everything is coming back. What is our philosophy? To push the morbidity from inside to outside, above downwards, internal to external. Asthma is there. When medicine is given to expel the germs from the lungs, some patients will have aggravation in the skin, some will have aggravation in the urine tract, some will have aggravation in the motion. If the skin aggravation is there, patient should have gone here. Last 5 years back I have gone to a very expert skin specialist. With his help I have suppressed all these medicines or diseases, eczema. After coming to this homeopath, I have done them. Now you must avoid the patient. Yes, you have got a very big tool. If you cooperate with me, not only your asthma and lung diseases will be cured, your skin disease also will be cured. Continue with me because the morbidity from the body should be expelled out. So by this statement, you can now understand how the and what is the morbidity that is suppressed in the body. So, lung diseases in the child, doctor has given medicine, injection. The child is alright. After 20 years, 30 years, 40 years, he gets frequent cold and cold. Whenever there is a climatic change, he gets problem. They need to say the lungs has been good. Understand this? As a homeopath, understand this. Morbidity is there in the body. All these, which are taken. Harmony is not very, very ardent. It is a God. It is genius. Through him, mankind is given this boon to expel all his problems for healthy things. Why yoga? Why yoga? Why pranayama? Why pranayama? All this because body will have a physical exercise, expel the morbidity that is hidden here and there in the joints and activity, wherever the muscular activities are there, wherever this fluid system is there, fluid system being blocked here and there. Of course, I am inviting modern MRI scan and heart scans, which clearly indicate that the blockage is there. Now, they are given introduced system, they have bypass surgery or stent, putting stent, etc., etc. It's a very costly method. Now, they themselves are given IV foods if we put them in periodical manner. All the accumulated fluids will come back. Not only the blood vessels, even in the lymph fluids. Because you see, when you give an IV fluid, it is not only going to the blood vessel, it is going to the circulatory system of the whole body. So, wherever the morbidity is there, that is expelled. So, innovations are there in both systems. But we have got armory. We are ever prepared for this problem. If a full-time amelioration of symptoms occurs without any increase in patient strength, he will prove too weak for restoration to health. He will prove too weak for what? For restoration to health. Restoration to health. That means, here it is an indication to the physician. You give an adequate remedy now to restore his strength so that he will become healthy. If the patient develops symptoms of the remedy given without improvement in his disease system, the case is hard one to treat. Even an experienced homeopathic physician finds it difficult to, it is a rarest of the case. Not all the 95% cases are incurable. 95% cases are curable with your effective treatment. Only 5 to 5%, 95 to 100%, 5% is very difficult to treat, even by the experienced homeopathic physician. What he will do? He will give only ameliorative medicine. Sir, do you need to say, we are giving this unmedicated medicines. The patient will be cured. It is possible. It is possible. Palliative drugs or ameliorative drugs try to think of the vital force. If the patient has got confidence, so if you ask what is sad in many of these patients, they are ardent followers of Hanuman. They will come, whatever be the condition. They will never say, oh, what is it? I am giving to him for 2 to 3 years, 4 to 5 years. Yes, for 15 to 20 to 30 years, there is up to his 40 to 50 years of age. He suffered everything. When all the medicines given by other system. If homeopathic medicine is not properly chosen, it is equal to treating a fruit tongue. Be careful. We have to be very careful. So, patient develops symptoms of the remedy given without improvement in the system. It's hard one to treat. And experienced homeopathic physician also feels very difficult. He has to use all his brain in the heart, everything. He has to refer. There will be some clue because there are thousands and thousands of symptoms embedded in the effect. New symptoms are added. New innovations are added. New drugs are added. Proven drugs. Slowly, Indian drugs are up to 300 to 400 drugs, Indian drugs, because they have been chosen from the Indian herbals. Turmeric, for example. If old symptoms appear with aggravation, you may wait. You need to study more. You have here very simply, he has narrated all the earlier statements stated by the physician, Dr. Boger. It's not my statement, Boger. Dr. C. Boger. He is anatomy, allopathy, MD. If the old symptoms appear with aggravation, you wait for that, you give palliative drugs. The patient problem, but you must teach the patient, I have given you health, restored health up to 60%. 40% of the problem still remains in your body. I am giving you my medicines. Either you go to any other homeopathic medicine, if you are not doubting me, you are welcome. But don't go to any suppressing medicines, because again you will go back square one. So are you criticizing or damaging? I am not. Systems differ. The actions differ. You are helping the patient by telling him clearly. You are not going to mock the patient. I know it is left to you. When you even go to death, don't do that. Tell him the truth. It is for you. If you got disappointed, it is for you to decide. I am not compelling you. I have brought you back from so many complications to this level. Accept it. If the old symptoms appear with aggravation, when we wait, you need to study more. You have other remedy. Please,
Harish, boy.
when we wait, you need to study more. You have the remedy. See, what a beautiful statement by God.
Rani,
All the symptoms appear, aggravations appear. How they appear? By aggravation. Then we have got the answer. We wait for the aggravation. Then we need not study at all. These aggravations itself is an indication to choose the remedy. You are choosing the remedy. And you are helping the patient to overcome all his past hurdles. And also one time, forward one. And choose for you to understand. I have many things to explain to you. Understand the homeopathy in different angles so that you are prepared for any eventuality. You are prepared for any eventuality. I have introduced this through Mr. Anup Kumar. I forwarded this chart to some 4 or 5 weeks back. Themes of Argentine. Themes of Argentine. I just read one statement. He fears to understand anything lest he fails. He fears to understand. Why? Because he may fail. When you ask the question, he will not be able to answer. So he knows the mark, he fails. He anticipates and sees the problems everywhere. Whenever he sees in atmosphere, outside world, anticipate problems everywhere. He can be afraid of losing his success, his gain. Oh, in the 5th standard, he has won 2 medals. Now in the 10th standard, he feels that he may lose the medals. That is, he has lost confidence in him. Success is his gain. The constant anxiety and the many fears takes a toll on his health. This has not only the present problem, it has got an impact on his whole body and mind. It changes, metamorphoses his mind structure for his future failures. The constant anxiety and the many fears takes a toll on his health, particularly his digestion. He can become hypochondriacal, eventually depression can take over and he gives up everything. The strain on his nerves can cause weakness, trembling and even paralysis. It's not easy to say. A person has to 40 years, 50 years, got paralysis. Is it the cause? No, don't leave it singly isolated. Constant brooding over the mind. Constant brooding. So, this we go through the method that is given there. Method that has been given there. Give you an idea how the mind activities interrelated. Your movement with the society interrelated. So, mind must be always pure and healthy. When mind is healthy, mind is strengthy, no one can touch you. You are the master. You can become IAS, you can become IPS, you can become very great man. Mind is the root cause for everything. Yes. Murthy sir,
Yes, sir.
shall I continue?
No, I will take, sir.
Okay, thank you, sir.
sir.
So, with all this, I think you have understood the problem. Because I don't want to make complication. But without the expressing the complications, things cannot be riddled. You must go into it. Come out of it. That is correct. Thank you very much. Thank you.
Is my voice audible? Hello?
Yes, sir, it is audible.
Thank you. Thank you, Surendra sir. A good explanation. Everybody must remember all these things and follow that one. As a homeopath, first you have to learn where three mistakes will be happen. One, the patient may not tell all his symptoms. Certain symptoms he will hide and certain symptoms he will tell, certain symptoms he will overboost. So these things we have to observe by observation or by asking along with the patient somebody will come. Second one, all the symptoms must be noted in our book or whatever you are maintaining. After that, thoroughly, just 2 minutes or 3 minutes, you pause and give your knowledge and select the proper remedy. 1, 2, 3 or 1, 2, whatever it may be. Instead of single medicine, better to go 2 or 3 medicines. That is the second one. After that, you ask the concerned person after 1 week or 10 days, please give the feedback. Like that we have to approach. Once if you take care of them, if they feel that we are concerned about their disease and we want to treat them perfectly, those patients will not leave us. Whenever anything comes, means they will come to us. And moreover, we need not give any advertisements or anything. This mouth-to-mouth advertisement itself will be working excellently. One thing, the symptoms must be tally to the symptoms of the disease must tally to the symptoms of the drug. Suppose if you don't know, we are having biochemicals, biosalts, that you can select. Or major all polycrysts are there. There you can select. You take pass. You ask the concerned person to come after 5 days or 7 days. You thoroughly read the book, or you ask anybody, get the information, get the proper solution, and next treat that one. So if you show the concern to the patient will never leave you. And one more thing, once if you cure means naturally along with the cure he will develop immunity also. That is the one of the best thing available in homeopathy. In no other therapy you will have immunity boosters. All our medicines along with treating their disease, acute or chronic, they will automatically increase their immunity inside. Nobody will tell after taking homeopathy medicine they are weak or they are having some abnormal back kicks. No, everything will be excellent. For example, a person comes cold means you cannot give him simply one drug. A person will respond to arsenicum album another person Eliasepa, another person Calibike, another person Pulsatilla. So individually, each person, each patient differs in selecting the remedy. Only symptoms will teach you which drug we have to give. And what are the antibiotics we are having? Equivalent to antibiotics. In homeopathy, that we must thoroughly know that one. Because we are also going in such a manner to speed up the recovery. So if a person is coming with a virus infection or virus fever, what type of medicines we have to give, we have to see that one, and we have to select accordingly. So be prepared with all the medicines what we have taught in our routine meetings and what you have studied in Google or in textbooks or whatever it may be, and practice. Put at least you take medicines yourself, you give medicines to your family members, you give medicines to your friends and nearby. By that way, develop, inculcate the habit of treating. It is one of the best service to the mankind. It is a seva. So you do everything with good faith, because homeopathy 100% perfect. It will never dig you anywhere. Only thing, we must have the proper knowledge. If you give properly means naturally everything will be there. It is a very beautiful knowledge, and anything you can relax in homeopathy. By reading homeopathy you can relax. That is the most important. In our MPHA, past 32, 30 years, 33 years I am in this homeopathy MPHA only. We are having allopathy doctors for anatomy and physiology, and allopathy doctors for gynecology and obstetrics also. So all the doctors are surgeons, experienced surgeons. All are having more than 20 to 30 years experience. Everybody is astonished, and we have conducted so many seminars. Every 6 months we will have a seminar. We will call allopathy doctor, senior most allopathy doctor, experienced allopathy doctor. He will give lecture for half an hour to 45 minutes for his subject. Even those people also very much interested in homeopathy, because without keeping a knife we are treating the persons very cheaply, very cheaply, and the patient will never afraid of it also. We will not give any fearfulness damages. One thing, even now in this stage also, what I am telling now, if any disease is very serious disease, means better to ask him to go to allopathy doctor. Don't venture it. For any boosting of his willpower or boosting of his immunity, you can give any biosalts or alfalfa tonic, whatever it may be. Everything is available in all areas. So be prepared to select a proper drug according to the symptoms of the patient. That we have to do. So today another 20 minutes are there. So we will take ladies drugs, female drugs, preferably menstrual disorders. What are the drugs available in homeopathy? Simply 5 to 6 drugs we will take. First and fundamental is Pulsatilla. Pulsatilla is one of the best remedy for amenorrhea, that is stoppage of menses, licoria, that is white discharge, dysmenorrhea, that is the stomach pain at the time of menstrual time, and difficult labor, that is at the time of pregnancy, when delivering the baby, at the time difficulty in fetus movement. The patient is mentally, here we have to see the mental symptoms also. To whom we have to give generally, the patient is mentally indecisive, they cannot take decision properly, and fickleness, changing mind, changing moods, very gentle, very gentleness, timidity, very mild. Whatever the symptoms they are telling, they will have water in their eyes. They cannot control any negative thoughts or negative sentences. So, and changing, another thing, very obedient, very fearful, so slow and yielding disposition. These people, if you select that one, Pulsatilla is very nice. Here, menses are scanty, sometimes totally delayed and suppressed, preferably wetting feet. When the feet is wetting, at that time stoppage of menses will be there. The persons will also tell, sir, flow will come the second day when I have taken head bath or when I am having an oil bath or anything, automatically stoppage. So when your feet is, general wetting is okay, but generally wet feet will create a problem in those people. Menses flow by fits, It will not continuously, it will not come fits. It will come 1 hour, after 2 or 3 hours again it will come flow. Like at that time it starts and ends, starts and ends. At that time also the pulsatilla will work. And moreover, pulsatilla is one of the best remedy for chlorosis girls, that is anemic patients. That also at that time we can give pulsatilla. Along with pulsatilla we can give ferrum phos, ferrum met, so many things are there. Next drug is sepia. It is also one of the useful remedy for amenorrhea, that is stoppage of menses, leukorrhea, white discharge, dysmenorrhea, stomach pain at the time of menstruation. And here the patient is very relaxed condition. If the patient is 40 years above, the lady is 40 years above, means very relaxed. They are not having any interest on anything, because in the younger age they are the persons, very leaders, dominant persons. All the work they will do, internal work, household work, outside work, going out, bazaar, and everything they will do. They will take the lead. That type of personalities are sepia people, very daredevils, very big. And these people generally after 40 to 45 years, the children become big adolescent stage. Husband will be for roughly 50 years or like that. He will have his own ministry. So those people will not give proper attention to that lady. That is the feeling for that lady. At that time she will be relaxed. Why should I do all these things? Nobody is responding properly. This type of mentality they will get. But leadership qualities will be there, everything will be there. And these people generally flat-chested people. Generally, not all, flat-chested people. Due to this relaxation, there is a threat of prolapse. So prolapse of uterus will be there more in sepia patient. Generally, these patients will not sit properly. They will sit crossed legs. One leg will be on another leg. Crossed legs. These people easily you can see those people. Bearing down sensation, as if everything will be coming out from the vagina. Menses are scanty, appear late every month. Suppose the person will get 27 days or 28 days or 30 days. It will come 2 to 3 days late. Another thing, there is a tendency of abortion. So it will be precautionary measures we have to take. When a frequent threatened abortion is there, we are having another medicine is Sabina, S-A-B-A-N-A, Sabina. It is also one of the best remedy for threatened abortion. Every 3rd month or 4th month abortion will happen. Like that twice or thrice it will happen. They will go to allopathy doctors, they will go other therapies also. Lastly they will come to homeopathy. Then we are having a best remedies. We select 2 drugs are there, pulsatilla, sepia, depending upon their mental symptoms, depending upon their fearfulness, depending upon their dareness, you select either pulsatilla or sepia, but along with that Sabina will work excellently. Along with that, to protective area, this one we have to give anemic conditions of biosalts, either ferrum phos, ferrum met, china, all these things depending upon the symptoms she expressed. So if you give 2 months treatment to her, means she will have faithful and she will have courage and she will have a great responsibility that she will bear against the pregnancy. So next is Lilium tigrinum. Leukorrhea is very watery and yellow. Yellowish, sometimes brown also, because naturally whenever the white discharge is there, some flakes of blood will also come. These Lilium tig people, uterus is heavy. So because of the uterus heaviness, these people will think the uterus may protrude. Prolapse of uterus will be there. So these people also, they will not always put crossing legs, but these people also will have so much of tightness. And some people, Lilium tig people will tell in uterus area we are having feeling heaviness, because heaviness is the most important in uterus region. All these people are having Lilium tig patients always in the afternoon or evening aggravations. Next, platina. Menses are very profuse, clotted will be there, and occurs frequent occurrence of very early. If a lady is getting 28 days or 30 days, these people will get 25 days, 3 to 4 days before. In sepia, 2 to 3 days after. In platina, before. And these people are very, very adamant people. We cannot use adamant, but they are very dominators, just like a king. They will never listen others' words. Everybody has to listen these people's words. Next, Simicifviga. Simicifviga is one of the best remedy. The persons who are getting frequent headaches, or sometimes they will call it migraine. They will tell, but who told you migraine? No, I know. Because regularly I am getting it is a migraine only. So those people who are having regular headache or frequent headaches, migraine symptoms, having uterus problems, though for those people Simicifviga will be one of the remedy, and Simicifviga is the best remedy for colic. Colic means dysmenorrhea, pain, menstrual pain. Next, creosotum. Creosotum is also one of the best remedy for copious bleeding along with leukorrhea. So leukorrhea and copious bleeding is one of the main remedy for creosotum. And acrid, corrosive, offensiveness will be there for these people. At that time creosotum we have to give. Helonias, it is one of the best drug. It is a tonic, actually uterine tonic. It will work leukorrhea, it will work dysmenorrhea, it will work for amenorrhea also. But good tonic, uterine tonic, you can give along with Alectris ferinosa for younger children, that is below 25 years. That is above 30-35 years, you can give Fraxinus americana. Along with that, you can give Helonias. Helonias is one of the blood counts will be increased. Blood color will be increased. The paleness in the females will be increased by Helonias. And next, calcarea carb. Calcarea carb is one of the best remedy for any menstrual problems, provided the patient is chubby, fatty, and whenever he is doing that lady is doing extra work or any urgent work or staircase climbing, all those things, she will get that what we call palpitation type of wheezing or thing. For those people you can give. This calcarea carb leukorrhea will be milky, very profuse, and undergarments will be always wet. Those people you can give calcarea carb. Calcarea carb not only the curative medicine, it is a constitutional remedy. So if the calcarea carb symptoms, physical and mental symptoms tallies means, you can damn sure you can give calcarea carb. Next, Alectris ferinosa I told, it is a one of the tonic for uterine people. You have ladies, preferably the young people, that is before marriage. Tiredness always, menses premature, and whenever menses comes very profusely it comes. Menstrual period, these people will be very tired and they want to always lay down. They don't want to do any extra work, physical work. For these people, it is one of the best remedy. Nowadays last 15-20 years, very 90% of the girls are having polycystic ovarian syndrome or polycystic ovaries disorder or disease, whatever it may be. Whenever they are told polycystic syndrome, PCOS, you can give this Alectris ferinosa, one of the best medicine for that. Previously I told when polycystic ovaries is there, what are the medicines I told? Anybody remember? At least now I want to ask question. What are the medicines available for polycystic ovaries? Polycystic ovaries before 30 years, generally 30-35. Nowadays people are getting married after 30 years, so you can have up to 35 years. After 35-30 years, actually uterus, anything comes with fibroids will come. What is the medicines available in homeopathy? Polycystic ovaries or fibroids? Both I am asking. You tell, think and tell. I will not tell. It is not a homework, because homework means you will forget one week. Again you will come on 4 o'clock at 4:10 at next Sunday. I will also forget. You will also forget homework. So now you tell. What are the medicines available in homeopathy on polycystic ovary syndrome or fibroids? Just now I told 2 medicines. That itself you can tell. Okay. Then what is the prime remedy? Whenever a person comes polycystic ovaries means what type of medicine you will give? Okay, calcarea carb we can give, calcarea floor we can give. This Fraxinus americana we can give, Alectris ferinosa. Polycystic ovaries are Alectris ferinosa only. Fibroids means you can go Fraxinus americana. But what is the prime remedy? Epismel. Epismel is one of the best remedy for polycystic ovaries starting stage. After that you can give anything along with that, any pain is there, collopydem you can give, semisepia you can give, sepia, pulsatilla, lilium tigrinum, that also we can give because it will work on the uterus only. Any medicine it is there you can give. So whenever you read that one, because Epismel if you start, Epismel, Pulsatilla, Sepia, these three medicines along with Aletris ferruinosa and Fraxinus americana, you will derive to minimum 2 medicines in that. Only ladies area, everybody is having boring. Only ladies area you take. Female paragraph only you read and note down. Guarantee 1 sentence or 2 sentences will be there, that you note down. Because nowadays 95% of the girls are suffering from PCOS or fibroids. From the age of 25 to 45, these two everybody will have. Some people will tell, some people will not tell. Because ladies, one particular peculiar mentality is there. Anything is there, if it come above abnormal stage means then only we will go to doctor, otherwise we will manage. Some party vaidhyam will be there. Party, elders they will tell some more local medicines, they will take that one and they will eat. Suppose if they tell asafoetida means they will take asafoetida. If they jeera means jeera they will take, jeera water. Like that so many things will be available in the house itself. Some grandma treatments, that grandma treatments they will follow. Or otherwise they will go to pharmacy and they will take one tablet and they will put. That is not the proper way. If anybody calls means, even if you don't, being a male, if you don't want to tell means, you tell through your, some female member will be there in the house, from them, you ask those people what are the symptoms and everything, they will tell, otherwise you ask the report. Pathology report will be there. There they will mention fibroids, polycystic ovaries, everything they will mention. Accordingly you give these 3 medicines or 3 medicines or 2 medicines, whatever you have selected, you give that one. Within 10 to 15 days, main symptoms will go. The primary disease of PCOS will remain there. So you have to give 1.5 months or 2 months totally. Once they get the guarantee that you are giving proper medicine, they will be with you only. They will not go anywhere. So always Epismel you select for a prime with this menstrual thing, anything is there, Epismel you can take. Preferably PCOS and fibroids, Epismel is the best remedy. And Aletris ferruinosa, always tired feeling, even at the menstrual period also they will feel that one. And Fraxinus americana, it is also anemic condition people and tired people and worn out people. Above 40 years means generally 50% worn out will be there, because 2 children and so much of the mental and physical worries will be there. So Fraxinus americana is also one of the best remedy and you can go through. So I think these are the few medicines available. If you read the book, you will get some more medicines, 2 to 3 medicines. Select minimum 8 medicines for female. These 8 medicines you always remember. Female and children, if you catch hold of those people, you will get good name, fame also. Because those people will suffer a lot without telling to anybody. If you give good medicines to them, you will be popular. By that way you will develop your own homeopathy. Practicing homeopathy is very, very easy. But the only thing, we have to constantly, every day, we have to read minimum 1 hour. Some medicine are, because if you read one, suppose Pulsatilla, if you read today, you will not master everything. Going on reading Pulsatilla, even 100 times you read, new symptom will come out. Because even Pulsatilla we are telling only ladies, but Pulsatilla is one of the best remedy for cold. Ripened cold, thick cold. So many things are there. Even undigestible food. So we are taking some festival season, we will do some sweets and everything in our house with more carbohydrates and everything, pastry food, and all those things will create a indigestion to our stomach. So at that time Pulsatilla, if you take it, will be very good. So many areas from top to bottom, so many areas Pulsatilla will work. And even Sepia, if you take, we are telling ladies this one, even if you even in your house or in your office, if anybody interact to you, you may not happy with them. Your mind will be zigzag. But you cannot talk with them. You cannot tell them that I am not happy with you, because you have to live with them, even office or home. So at that time agitation will be there. For those that think also, sapia will work excellently. Those things will be removed. So where sapia will work mental symptoms, where ignitia will work mental symptoms, where natrum will, the beautiful things, because our day-to-day life, these medicines are very, very important. Natrum, Staphylos aureus, ignitia, sapia and pulsatilla. These 5 medicines, mental symptoms. Suppose I am 72 years old. My son is there, my daughter is there, and my wife is there. Sometimes they may not listen my word, or sometimes they will dominate me, or I will feel that they are dominating me. So at that time I cannot tell, because they are my loved ones. So at that time agitation will be there in our mind. At that time what type of, that to control that agitation, what type of medicines we have to take under these 5 medicines will be. If you read these 5 medicines, you will get another 2 to 3 medicines. By that way you have to develop your knowledge. Repeating, that's all. Simply keep purchasing the book and keeping in the house is nothing. That drug will be in the book only, it will not go to our mind. So if the drug symptoms has to go to our mind, means we have to read. Today excellent lecture Sunendra sir has given. Because I have already recorded, I am sending that one. Please listen that one. So many precautions he has told. So many practical side he has gone. Okay, time is up. I think no more doubts. So next week we will see. I think next week George sir will take next Sunday. Okay, sir?
Yes, sir.
Okay. Next Sunday George sir will take. We will see afterwards. Thank you very much. Next Sunday we will meet.
Welcome.